Yes, hi, hello everyone. Welcome to Forensic Medicine and Toxicology. Today we are going to discuss one very important topic, medical ethics. Hi guys, I'm audible and visible. Is it clear? Audio video, is it clear? Yes, fine, okay. Sumanya, Nikhil Malik, Osama Sheikh, Ananta Krishnan, Mirza, all clear, no? Yes, Lion, all clear? Yes, so I think Nikhil Malik. Okay. So, medical ethics, one very commonly asked 5 marks question in your university exam. Okay. What is medical ethics? What are the principles of medical ethics? And examples. Or the question can be asked, what is infamous conduct or professional misconduct? What are the principles of medical ethics and the examples? Our 3 marks question, what is the proceeding or what is the punishment in case of infamous conduct? So all these are 5 marks and 3 marks questions. And in your NEET PG exam, FMG exam and INI-CET exam, this is very commonly asked question. All are the examples for infamous conduct except like that. Okay. Yes. Okay. Nusrat, Anjum, Manikarnika Mehatre, Mukunda Gupta, Sarkar, Somedip Sarkar, all welcome to the class. Forensic medicine, medical ethics. So, medical ethics. So, in simple word, it is a chikitsa naitikata. Chikitsa naitikata. So, in first class, we discussed about definition of forensic medicine, definition of medical jurisprudence, medical ethics, and medical etiquette. So, what is medical ethics? Yes. So, before that, let me start with this caption. A good doctor with genuine intentions is next to God. So, doctor is next to God. A good doctor. How many of you agree with this? Can you reply me yes or no in the chat box? So, आप में किससे okay, how many of you in favor of yes, and how many of you say no? Say yes or no. Yes, agree. Yes, agree. Soumyadeep, yes, agree. Osama, true, sir. Okay. Parth Patil, yes, sir. Anantakrishnan, okay. Yes, fine. Yes. So, doctor is considered as next to God. So, we are bound to some moral principles. Okay. We need to maintain some dignity. Okay. So, that is what the medical ethics, that is nothing but chikitsa naitikata. Okay. Yes. So with this now we are going to start with the definition of medical ethics. So we doctors are next to God. So we are bound to some moral principles. So what are they? So and what is the definition? So that can be asked in your university exam. Define medical ethics. What are the principles? Okay. Yes. As per standard textbook, medical ethics is study of moral principles and code of conduct which guides the members of medical profession in their dealings with each other. So we need to maintain some moral principle in dealing with each other. We need to respect each other. We need to respect fellow doctors, colleagues, so and their patients and also the state. So we are bound to moral principle and code of conduct, that is known as medical ethics. Okay. Yes. Yes, yes, yes. Any profession, medical profession, even paramedical courses, it is applicable. Okay, moral principle and code of conduct. So all of you write in the chat box. Let's make it interactive. Ethics is equal to what? Morality. Naitikata. Write this in chat box, everybody. Keep writing. So keep me awake. Keep yourself awake by writing something in the chat box. So one time rating is equal to 10 time reading. Everyone, please write. Keep writing. Ethics is equal to morality. Good, good. Soumyadeep Sarkar, good. Nusrat, yes. Manikarnika, very good. Samantha, very good. Partha Patil, good, good answer. Now, what are the principles of medical ethics? So, there are 4 principles. So, they can be remembered with the help of mnemonic. Bhajan. So, mnemonic is Bhajan. So, BJAN. Bhajan is the mnemonic. So, this can be 3 marks question. Okay. What is that? 4 pillars, 4 principles. B for, what is that? J for, A for, and N for. So, this we are going to discuss now. B for beneficence. 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 J for justice. Justice. A for autonomy. N for non maleficence. Non maleficence. So, remember mnemonic is Bhajan, beneficence, justice, autonomy, non-maleficence. So, there are 4 principles. Let's discuss one by one in detail about it. So, all of you just write the mnemonic. 4 pillars is equal to Bhajan. Write this in the chat box. Everyone, please write this. Everyone, please write this in chat box, guys. Let's discuss about beneficence. Or let's start with the one autonomy. See, let's see what is autonomy. Let's talk about autonomy. It is basically the first pillar of the medical ethics. See, autonomy means swayattata. So, autonomy means swayattata. It is basically the patient's right in accepting treatment or in refusing treatment. So, what is autonomy? It is a patient's right in accepting treatment or in refusing treatment. So, patient, he has right. So, he can accept certain treatment. He can also refuse some treatment. Like example, say a case of ischemic heart disease. So, in ischemic heart disease, treatment options are, one is angioplasty, the second one is CABG, that is coronary artery bypass surgery. So, you need to explain the patient about the procedure, the complications, and also the outcome. Then you need to take the consent. So, that is known as autonomy. Autonomy means patient's right. So, it includes consent and confidentiality. Consent and confidentiality. So, remember, so autonomy consists of 2 components. What are they? One is the patient consent. So, without consent, don't do any surgery or don't do anything. The consent is very important. So, that is what autonomy. So, and confidentiality. You need to maintain 100% confidentiality, secrecy with you. So, that is nothing but your autonomy. Okay. 4 pillars is equal to, that is Bhajan. Very good. Very good. Anybody can answer what is the consenting age for surgery? What is the consenting age for surgery, guys? Anybody? Surgery, say example appendicectomy or coronary artery bypass surgery or whatever, any operation, any surgery, what is the consenting age, legal age for giving consent? Can anyone answer? Anyone? Yes, very good. So Anantakrishnan, very good beta. Anantakrishnan, excellent answer. He said, sir, 18 years. Excellent, excellent beta, excellent. So it is 18 for surgery, for medical examination 12 years. For medical examination 12 years, surgery 18 years. Now here one more question is there. What is the consenting age in medico legal examination? Like example, a case of rape, victim of rape. Victim of rape, consent is mandatory. What is the consenting age for giving consent during examination of victim? Anybody? Medico-legal examination. Medico-legal examination. What is the consenting age? Is it 18 years, 16 years or 12 years? Let's see who is going to answer this. Come on guys, one who answer will get chocolate from me. 3D chocolate in the comment section. Okay, 3D chocolate. Let's see, very good. Osama Sheikh. So many answered correctly. It is the 12 years. 12 years. Excellent answer. 12. Good. Good. 12 is the correct answer. So that is really nice of you guys. So you should get a chocolate from me. Yes, there's a 3D chocolate for you. There's a chocolate for you in the chat box. You can take. Happy all of you? Happy? Yeah. Second component we are talking about is beneficence. So what is beneficence? Beneficence. See, beneficence means always your treatment. When you deal with the patient, always you should give your best, or you should work for the interest of the patient. Best interest of the patient. So beneficence means best interest of the patient. For the best interest of patient. That is beneficence. Beneficiary. Upakara bolte हैं ना, beneficence means upakara. That means that is best interest of the patient. Always you should work, you should treat, you should do surgery for the best interest of the patient. Okay, that is what beneficence. Then comes is non-maleficence. So non-maleficence. So the meaning of this is don't do any harm. Don't do any harm while treating the patient. So while treating patient, you should maintain standard care in treatment. Standard care and treatment. So do not harm the patient. That is what the non-maleficence. Do not harm. So do not harm. Don't do any wrong counseling. Don't do any wrong surgery. Don't do unrequired surgery, and so all this comes under do not harm. That is nothing but your non-maleficence. And the last one is the justice. So justice means it is equality. So your service should be available to all the patient, irrespective of your race, religion, profession, whatever it is. So your treatment, your service should be available to all of them. So that is what the equality, that is nothing but justice. So there are 4 principles, guys. So the mnemonic is bhajan. B for beneficence. Beneficence means that is the best interest of the patient. So J for justice, that is nothing but equality. So every patient is equal. And the third one is non-maleficence, do not harm. And the last one is autonomy, that is the patient's right. So this is about the 4 pillars. 4 pillars. Okay. Yes, fine. Now let's see one example. Now this is one good example. Let's discuss about this. A doctor amputates left gangrenous foot from the leg of the patient against his wishes. Against his wishes. Is it ethically correct? If it is correct, it is against which principle? Among the 4 principles: beneficence, maleficence, justice, and autonomy. Anyone can you answer this? Anyone can answer this question? Yes, come on. Which principle is comes in this scenario? In this scenario, which is the principle of medical ethics that goes wrong? Yes, very good. So this is nothing but your autonomy. I said no, consent. So whenever there is a question of consent, you must take the consent. So don't do anything. So it's good or whatever it is, don't do anything without the consent of the patient. You should maintain 100% confidentiality, 100% autonomy. That is what the principle. Yes. Non-maleficence is violated. But here autonomy is violated. Non-maleficence, basically the treatment is definitely amputation only. So maybe it is beneficial, but it is against the autonomy. That is the correct. Parth Patil? Yes, fine. Okay. Okay. Next, one more condition here. A doctor terminates a pregnancy of an unmarried girl of age 19 years, unmarried girl, caused without the consent of the mother, without the consent of the girl, or with the patient of the with the consent of the parents. Now age is 19 year. Age is 19 year. The consent is taken from the relatives, or consent is taken from the parents, but not from the girl. Then is it ethically right or wrong, or it is what principle? Anybody? Yes, very good. Okay. Okay. ठीक है पार्थ पाटिल anyway the image find that is wrong. It is basically autonomy again. So when we talk about autonomy means it is patient consent. So this is what I was trying to explain. Now let's see one more scenario there. Say example, a case of snake bite. You can see there are fang marks are there, and the first important component of treatment is the counseling. So the counseling, psychological counseling is very important. Why? Because improper counseling can lead to heart attack. The most common cause for heart attack in case of snake bite is the fear. So as a doctor, you should do proper counseling. So improper counseling during snake bite management leading to death of the patient due to MI. Now, dear students, what is the principle that is violated in this case? Anyone? What is the principle violated here? Yes, very good, very good. Anybody? Yes, so Sutapa, remember for MTP, the consenting age is 18 years. Consenting age is 18 years. So here 19 year, so you need to take the consent from the patient itself. Okay, simple it is. The consent from the relatives, consent from the husband is not required in MTP. Okay, when age is more than 18 years. Less than 18 year, you need to take the consent from the parents. Yes, so non-maleficence, very good. So this is against the non-maleficence. Efficiency, very good. Excellent answer. Excellent. Good. So this is about the examples. Yes, guys, have understood this four principles. Definition have you understood, and also the four principles. Is it okay? Shall I move ahead? Say yes or no in the chat box. Say yes or no in the chat box, guys. Please. Come on, guys. Come on. Clear. Dr. Parth Patil. I'll go a little slow because all these topics are not that easy to understand. I'll go a little slow in the beginning, 1 or 2 classes. So once you adjust with my speed, then I can increase the speed. Okay. Yes. Clear, no? Clear. Yes. Improper counseling. See, better that you should know proper counseling important. So in case of snake bite, so the one very important component is the counseling. So you should counsel the patient. You should decrease the fear that is in mind of the patient. So improper counseling. So sometimes the snake bite can be caused by a non-poisonous snake. So that we'll discuss in our snake bite classes. So time being, it is against the non-maleficence. Okay. Now, chalo. Next important topic, guys. So suddenly all of you There's a picture of one of the famous movie, Arjun Reddy, and it is the movie about the alcoholic surgeon. Can you guess what would be the next topic, guys? What would be the next topic by looking at this picture? Yes. Come on, guys. Come on. Next topic. Can you guess next topic? Chalo, chalo. Malpractice. Beta, ye malpractice. Malpractice. Okay. Any accurate answer other than malpractice? Malpractice includes medical negligence and infamous conduct also. So, anybody? Medical negligence, fine, okay, fine. Anything else other than the medical negligence? Other than that, alcoholic surgeon I'm talking about. So, treating the patient under the influence of alcohol, under the influence of drug, under the influence of some other substances. So, what it is basically? Definitely, it is a punishable offense under the IPC sections. And what it is known as? It is not a normal conduct. It is not a standard conduct. It is something, something else. What is that? Professional misconduct. Very good. So, Anantakrishnan. So, this is basically professional misconduct, also known as infamous conduct. Okay, next heading, professional misconduct or infamous conduct. So, this can be a 3 marks question, 3 marks question, can be a 5 marks question. It can be very important INI CET question, NEET PG question. It is asked more than 50 times in last 5 years. Professional misconduct. Okay. Yes, good. So, we are talking about professional misconduct. So, it all comes under NMC Act. It comes under NMC RMP Professional Conduct Regulation Act 2022. Okay, it comes under what? NMC regulations. NMC RMP Professional Conduct Regulation. So, what do you mean by professional misconduct? What do you mean by warning? What do you mean by warning notice can be asked in your exam. So, professional misconduct. So, it is basically about the offense. So, the list of offenses that is given at the time of registration. So, at the time of registration of our degree, MBBS degree, MD degree, so NMC or State Medical Council, they provide you a list of offenses. So, we should not do those offenses. So, that is basically known as warning notice. Okay, warning notice at the time of registration. Let's see what is professional misconduct as per standard textbook. Professional misconduct is dishonorable, disgraceful conduct of a doctor, disgraceful conduct of a doctor. So, in their medical profession. So, in their medical profession, when they are dishonorable, when they are doing something which is disgraceful, that is known as professional misconduct or infamous conduct. So, the mnemonic is very famous mnemonic 6A disco. 6A disco. So, what is the mnemonic for remembering the infamous conduct? Your answer should be 6A disco. All of you write this in the chat box. 6A disco is equal to infamous conduct. Likho everybody. Infamous conduct is equal to, all of you write in the chat box, guys. 6A disco. ठीक है, चलो. Yes, everyone keep writing, guys. Keep writing so you can motivate me to take some good lecture. Okay, chalo. Yes, good 6-8 disco. Good, keep writing. Everybody should write. Chalo. So, let's see what are the examples. So, in brief, so 1A is advertisement. So, advertisement, improper advertisement. Okay, so improper advertisement using large signboard, large signboard with photo of the doctor, with all offers in treatment can be advertisement, improper advertisement. So that can be infamous conduct. Okay. So infamous conduct, one example is large signboard, large signboard, okay, with photo of the doctor, with photo of the doctor. So you can use small signboard, you can write the name of the doctor and your degree and your specialization. So don't write anything, don't do any advertisement in TV, media repeatedly, and a personal advertisement, don't do that. So that is basically against the laws of medical ethics. So that can be advertisement using large signboard. Now anybody can answer, can we do advertisement? Say example, I'm opening a new clinic. So tomorrow I'm opening a new clinic in Bangalore, new hospital in Bangalore, new nursing home in Bangalore. Can I do advertisement in newspaper or media or in some other platform? Can I do that? Anybody? Anybody? Say yes or no. Come on, anybody say yes or no. Yes, you can do. So when you are starting a new hospital, when you are changing the address, when you are starting new equipment, say example, I'm starting a new MRI scan in Bangalore, some MRI lab in Delhi. So I can do advertisement within 30 up to 30 days. I can do about this. Okay. So, but using large signboard with the photo of the doctor, telling 1+1 offer, giving 60% offer. So all this is basically infamous conduct. Okay, yes, you can do, and very good, very good. Many answered. That's great. So a advertisement you understood, usually up to 30 days. Okay, so not beyond 30 days. Okay, yes, that is about the advertisement. Second, adultery. Adultery. Adultery means, so having sexual affair with the patient. Having sexual affair with the patient can be adultery. Okay, sexual affair with the patient. With the patient. Okay. Yes or no? So while treating, no, while treating, so don't do all these things. Okay. So sexual affair with the patient can be adultery. Even doctor can be arrested under sections of BNS also. So BNS also applicable here. Even regulations of NMC also applicable here. Okay, that is adultery. Adultery. Mistreating with the patient. Very good. Soumyadeep Sarkar, very good. So he said, sir, mistreating with the patient. Okay, good. Then not only patient, even colleagues also. Remember, colleagues can be adultery. Addiction. Addiction, so it can be drug addiction. So drug in a sense, it can be anything. So it can be barbiturates, so it can be morphine, or it can be ganja, it can be heroin, any drug addiction. So treating the patient under the influence of drug addiction can be infamous conduct. A for addiction, A for advertisement, A for adultery. One more A for alcoholism. So treating the patient under the influence of alcohol. So what is the meaning of that, guys? So that means is alcohol is prohibitory for the doctors, or only during practice you should avoid? What is the meaning of that? I said alcoholism. So what is the meaning of that? So say a doctor is taking alcohol after his clinical practice, or taking alcohol during clinical practice. Which is more punishable, or which is punishable, guys? Which is punishable, or which is under medical ethics? Anyone? Only during practice. Very good. Okay. No. Sutapa Samantha, I said, so you can do advertisement. So that is the proper advertisement. So that is in newspaper with the, so when you're starting new treatment, when you're starting some new lab, or when you're starting clinic and nursing home, you can do that. You can do that. So okay, yes, I said large signboard everywhere in the city with your photo. So all this is not acceptable. Fine. Alcoholism only during the clinical practice. Okay. So while treating patient. So while treating patient. While treating patient. Okay. Yes. Now let's see some more is okay. Association. Association. So while doing a practice, while treating the patient, so you should associate with someone medico only. So medico are the medical person, are with the proper degree. So don't allow any person, so other than the medical person while treating the patient. So that is known as covering. Okay, covering. So allowing some non-medical person while treating the patient, while doing examination. Say example, you are examining a patient in a room. So you are allowing someone your friend, someone your friend who is a non-medico and to the room, so examination room. So that is basically association. So that can be a covering. So covering means association with unqualified person. Unqualified person, that is known as covering. So all of you write in the chat box, association is equal to covering. Association is equal to covering. Write this guys in chat box. Keep writing. Yes. ठीक है. Next. So all this about the five association. Next is the abortion. Abortion. ठीक है. So there are six A's. A for advertisement, A for adultery, A for addiction, alcoholism, association, alcoholism. So there are six A's of professional misconduct. Any doubt in this, guys? Association is equal to covering. Mohammed Soeb Khan, can you write this in the chat box? Mohammed Soeb Khan, can you write association is equal to covering? Covering means allowing someone who is a non-medical person, unqualified person. Okay? Yes. Lab assistant. So lab assistant will be there in the lab, no? Not in the examination room. Not in the examination room. Okay? Okay. ठीक है. Fine. So this is about the 6A's. Now we're talking about some more dichotomy. So dichotomy. What is a dichotomy? Can anyone answer? Dichotomy. In simple word, dichotomy is equal to split, fee splitting. Fee splitting. That is taking commission or giving commission while treating the patient. So either from the pharma company or giving some commission to someone, some other doctor, one who refer. So fee splitting is nothing but your dichotomy. Dichotomy means fee splitting. Okay. Yes. Fine. Abortion. Yes. Abortion. Fine. A good question from one of the student. Sir, what about the abortion? See, there are some indications for abortion. So there are some eugenic indication, therapeutic indication, social indications, and also other indications, right? So when you are doing abortion without any proper indication, so without the indication that is given in MTP Act, so that can be a professional misconduct. Okay, so therapeutic abortion without any valid indication is infamous conduct. Okay, it is also against the MTP Act. So MTP Act. Okay. So this is about the 6 years. Fine. Dichotomy I discussed, that is nothing but fee splitting. Dichotomy, taking commission, giving commission. Okay. Fine. So Supata Samant, dichotomy means you are giving commission. Say example, doctor is there here. Say example, doctor. So doctor, one more doctor, one more doctor, and this doctor is referring patient. So what he will do? He will refer the patient, and this doctor will get, say example, 500 rupees as the consultation. 500 rupees. For referring this patient, he will give some 200 rupees to the doctor 1. So doctor 1. So this is known as dichotomy. Giving commission, taking commission, so that is known as dichotomy. Have you understood this? Sutapa Samanta, have understood this now? No, it is not like that. Somadip Sarkar, it is not like that. So he is also a medical person. He's also a medical person. He's not doing any active procedure, right? So it's a medical college, and then definitely it is not an punishable offense. So, but non-medical person, so that is actually known as covering. Again, it is different from different circumstances. Okay, while examining a female patient, there should be a female attendant. Okay, so a male doctor should examine any female patient in presence of female attendant. So there are other rules also that we are going to discuss in next chapter. Okay, so dichotomy, as time being, it is the fee splitting, or it is taking commission, giving commission. Okay, fine. Yes, dichotomy is punishable. He might get a warning notice, and also it is punishable under other sections of BNS also. BNS also, if it is proved in court of law. Then issuing false certificate. Say example, doctor is issuing a false certificate. Can be a injury certificate, postmortem certificate. So false certificate, that is actually known as infamous conduct. It is also punishable under 229 BNS. 229 BNS. So write this in the chat box, guys. Issuing false certificate is an infamous conduct. It is also punishable under 229 BNS Bharatiya Nyaya Samhita. False certificate is equal to 229 BNS. So write this. This is very commonly asked in your Viva, very commonly asked in your INI-CET exam. BNS, Bharatiya Nyaya Samhita. Okay, good. Good. ठीक है. Now we are going to discuss about DISCO. We're discussing D for dichotomy, issuing false certificate. Yes for sex determination. So yes for sex determination. So there are hundreds of example. Okay, given in your NMC regulation, there are hundreds or 500 examples in your NMC. So we are discussing only the main infamous conduct. One more is the sex determination. Sex determination of the fetus. Okay, so by using ultrasound or any other technique, amniocentesis and all. So sex determination is also punishable under PCPNDT Act. Okay, so it is also punishable under PCPNDT. Yes, good. So it is also punishable under PCPNDT Act 1994. PC means preconceptional, prenatal, Diagnostic Techniques Act. Diagnostic Techniques Act. So sex determination of the fetus, that is in the uterus, male or female, it is a punishable offense under PCPNDT. So anybody, is it a bailable offense or non-bailable offense? Can anyone answer? Is it a bailable offense or non-bailable offense? It is definitely a professional misconduct. It is also offense under BNS. My question is it bailable or non-bailable? PCPNDT means Preconceptional Prenatal Diagnostic Techniques Act. Okay. Non-bailable. Non-bailable. Very good. So it is a non-bailable offense. So as per PCPNDT Act, it is a non-bailable offense. Okay. Next, covering. Already we discussed about it. Covering means association. Others, like one example is disclosing secrets of the patient. So doctor should maintain 100% secrecy about the patient diagnosis, about the treatment option, everything. So when doctor is not doing that, when doctor is not maintaining 100% confidentiality, then it can be infamous conduct. Okay, so doctor should be 100% confidential. Confidential. Okay. So let me ask you one more question, guys. So consider a male and a female. Consider a male and female. So the male came to you and he is HIV positive. He is HIV positive. You came to know with certain test known as ELISA test and Western blot test, he is HIV positive. As per rule, you should maintain 100% confidentiality. Yes or no? So this female, so fiancé, say example, this female is a fiancé. Fiancé. She is going to come. She is going to ask you about the diagnosis of the male or the fiancé, that's the male. So anybody, can you disclose the diagnosis of HIV positivity? In this case, male, female, male patient, your patient is male patient is HIV positive. So, and as you know, the HIV is a sexual transmitted disease. The fiancé do come to your clinic. She will ask you about the reports of the your patient. Can you disclose in this case? Anybody? Can you disclose in this case? Yes or no? Yes or no? Can't disclose. Somebody is telling sir can't disclose. Otherwise, what happens? So once they marry, so anyway, sexual intercourse is the most common cause. So there can be transmission of HIV, which is very difficult to treat. There's no treatment for that. Yes or no? So anybody, what is this condition known as? What is this condition known as? Where doctor is disclosing the secrecy or the diagnosis of the patient to the relative or the fiancé in HIV positivity in some cases. What is that known as? What is that communication known as? Anyone, can you answer this? Sumanya, Partha Patil, Mirza, Sutapa, Samantha, Partha Patil, Lion, Muhammad, Ananta Krishnan. This is one exception, guys. There is one exception where doctor can inform the fiancé, doctor can inform the police, doctor can inform the court in certain conditions. What is that known as? Anybody? If you answer, I'm going to sing a song for you. I'm going to sing a song for you. You are going to enjoy that. Yes, very good, very good. Devangani said, sir, privileged communication. So, privileged communication. Excellent answer. Excellent answer, guys. Excellent answer. Okay. Yes, good. Wasama Sheikh, good answer. Yes, you answered no, that should be a song. Okay, anyway, I'm going to sing a Kannada song for you. Okay, very simple. I'm not a very good singer. I'll try my level best. ಗೊಂಬೆ ಹೇಳುತ್ತೈತೆ ಮತ್ತೆ ಹೇಳುತ್ತೈತೆ ನೀನೆ ರಾಜಕುಮಾರ ನೀನೆ ರಾಜಕುಮಾರ. Okay, fine. Okay, 100% confidentiality, privileged communication. Good answer, good. So yes, so this is about the one example, right? Good. Chalo. Next example for the infamous conduct is use of Red Cross emblem. Red Cross emblem. How was this song, guys? How was this song? So was it funny? Yes. So yes. Okay, some other day I'll sing a Hindi song also for you. Okay, Hindi song, Telugu, Tamil, whatever song you need, I'll just tell you. Don't worry. Today only the Kannada song. Okay. Okay. Somidip Sarkar. Okay, good. So last week we had one more song, no? So nice song, right? Chalo. So next example is use of Red Cross emblem. Guys, can we use Red Cross emblem like this? Red Cross emblem. Red Cross emblem. Can you use that? Is it like this, guys? You know? Let me. Yes, I'll take highlighter. Highlighter, guys. Yes. This is Red Cross emblem. Can we use this Red Cross emblem? Yes or no, guys? So this is Red Cross emblem. Yes or no? Okay. Can we use that in over our vehicle, say bike, car, whatever it is? Can we use that Red Cross emblem? Is it legal, illegal, guys? Is it legal, illegal? No, 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 no. Yes, it is illegal. Use of red cross emblem is a punishable offense under the Geneva Convention Act. Under Geneva Convention Act 1960, so it is a punishable offense. The punishment can be 500 rupees fine and also the forfeiture of the vehicle. So, okay, use of red cross emblem, no. So, the symbol which we can use is this symbol you can use. Okay, this is the symbol, a new symbol. So, that we'll discuss in the next slide. So, time being, remember, it is a punishable offense under Section 12 of Geneva Convention Act 1960. Next, running open shop for sale of medicine. So when doctor is opening a open shop, anybody can come. So even patients of other clinician can come. So they can buy medicine from the doctor. Then that is also infamous conduct. So running open shop for sale of medicine. So that is also infamous conduct. Then other example like refusal to treat the patient under religious background. So religious grounds, so race and all, caste and all, that is also infamous conduct. So not informing health authorities about notifiable diseases. So there are certain notifiable diseases, like example tuberculosis, cholera, snake bite. All these are notifiable diseases. When doctor is not notifying those diseases to the authority, to the health authority, then it is can be infamous conduct. So there are many examples, guys. So mnemonic is 6A disco. 6A disco we discussed today. So I'll repeat again all the 6A's. So A for advertisement, A for adultery, A for addiction, A for alcoholism, association and abortion. Then D for dichotomy, I for issuing false certificate, sex determination, covering and others. So others like all these are the examples. So 6A disco is a mnemonic for infamous conduct. Have you understood, guys? Yes, definitely you can disclose in certain cases. Already married also, who knows, there can be, the transmission, has different efficacy, right? Efficacy or efficiency. So you need to inform the spouse. When the spouse comes to you, they ask you about the HIV status, you need to disclose. You need to disclose. So that is the rule under privileged communication. Okay. Yes, all of you have understood. Shall I move ahead? Can you just tell me what is this notifiable disease? Look at this. This patient is having water. So when he is having water, suddenly there is a contraction of the laryngeal muscle and there is a hydrophobia. What is this notifiable disease? Yes, anybody? Rabies. Good answer. This is basically rabies. Rabies, and this is hydrophobia. Hydrophobia. So it is a notifiable disease. Notifiable disease. So other examples are like COVID-19, rabies, snake bite also. Okay, snake bite also. Snake bite also notifiable disease. Okay, chal. Next. Say example, doctor is giving some secret formula. Okay, secret formula, secret medicine. It is also infamous conduct. Secret medicine without any composition. So that is also can be infamous conduct. Now there is a question for you guys. Can a doctor run a open pharmacy shop, sell a drug at his own clinic? Okay, own clinic. Yes or no? Yes or no? Can he sell medication to everybody? Open shop, like Apollo shop is there, open shop to the all the patients. So others patient, his patient, everybody can come and they can buy. That is known as open shop. Open shop. But remember, doctor can sell medication to his own patients. He can sell medication to his own patients. But when he's opening his open shop in his own name and he's selling drug, then it is infamous conduct. Open shop, there's a difference between open shop and selling medication to his own patients. So there's a difference between the both. So this is actually infamous conduct. Okay. Okay, good. Chalo. Next. Now all of you, what about this? Doctor writing prescription in the form of secret formula which is known to some particular pharmacy. Some particular pharmacy only. So doctor is writing some secret formula and advising him to go to some particular pharmacy and ask him to buy medication from that. Is it infamous conduct? Yes or no? Yes or no, guys? Yes or no? Yes or no? Yes. So this is, you can see the handwriting, and also you can see there is no it's not a proper prescription. So what is proper prescription and all we are going to discuss in upcoming classes. So this is also infamous conduct. Good. Now look at this, guys, and you need to tell me which A is included in that. Which A? We said 6A, no? 6A disco, I said. 6A disco. And look at the image and try to answer what is that A that is affected in this scenario, or that is related to this. 6A. What is the 6A, guys? Look at this scenario. There is a patient and a doctor, and the doctor is doing something here, and the patient came with a history of left knee. So came with a history of left knee pain, and the doctor is trying to examine, something else, right? So what is this, guys? So this is adultery. Who answered? Okay, who answered adultery? I think first to answer is by Sarkar. Sarkar beta, excellent. Sarkar. So this is basically adultery. Adultery. Now look at this one more scenario. A doctor and the patient. The patient is in your clinic. Doctor is telling, and doctor is giving treatment, and patient is telling, doctor, my child is having high fever. Will you please come and treat? And also you can see here there is some alcohol bottle is here. So what is that A that is affected here? Anybody? Yes. No. So try to answer, guys. So this is first to answer by Mirza. Mirza beta, very good. Very good. So this is definitely because he is under the influence of alcohol. So treating the patient under the influence of alcohol, so he can have alcohol after the after his clinic. So once he go home and he can have alcohol, whatever he want, he can have alcohol, beer, whatever it is. But during clinical practice, having alcohol and treating the patient, when it is proved in court of law, then it is punishable offense. Then it is alcoholism, known as infamous conduct. Okay, good. Yes, he can also refuse to see the patient. Yes, he can refuse the patient to, so he can close his clinic and he can go. But now here you can see here the doctor is there, patient is also there, both are doing some interaction. So this is what wrong I'm telling you. Okay, this is for only for academic purpose. Okay, yes, fine. Next, look at this. Here is a patient and a doctor, and one doctor is telling. So what doctor is telling? So he's telling, oh no, I never thought Dr. Sahani is so poor in surgery. So he's blaming another doctor in front of the patient. Your hand has not recovered even 5% after surgery. So this is what you are blaming some doctor or disrespecting some doctor. Disrespect. Disrespect towards the colleague, towards the colleague. So this is a definitely infamous conduct. So anybody, this is infamous conduct. It comes under so professional misconduct as well. Okay. Yes. Fine. Sutappa Samantha, what is your doubt? Your doubt is, sir, if abortion done under the MTP Act. So yes, under the MTP Act, under regulations of MTP Act. Okay, so there are some rules of MTP indications also, and doctor should have certain degree in that. Okay, then if it is all within the clause, within the clause of the MTP Act, then it is not infamous conduct. Okay, yes, fine. So this is professional misconduct. So you need to respect your teachers, you need to respect your colleagues, you need to respect your seniors. So especially don't do any act of disrespect in front of the patient. Okay, so that is what the professional misconduct given clearly in NMC. Next. So this is one more example, guys. So you consent to undergo blood test, stress ECG, echo. So he is taking blanket consent. So doctor is taking blanket consent. Okay. So blanket consent. So this is also can be infamous conduct. Okay, infamous conduct. Yes. Next. One more, guys. What is this, guys? What is this phenomenon of infamous conduct? There is a non-medico person. So there is a non-medico. You can see here non-medico. So he must be a non-medico. He must be a doctor. He must be a doctor. Doctor, you promised 200, but it's only 100 rupees. Then doctor is telling balance will be paid when patient pays. So doctor is taking commission, giving commission while referring patient, while seeing patient from the non-medico or from the medico. What is this known as? Anybody? Dichotomy. So this is basically known as dichotomy. Good. So giving commission, taking commission is dichotomy. It also comes under various sections of BNS, comes under bribery also. And one more example. So this is about the infamous conduct, guys. Infamous conduct. What is blanket consent? So blanket consent is the consent that is taken at the time of admission. So that includes consent for whatever investigation do, whatever procedure they do, whatever surgery they do at the time of admission. So that is the blanket consent, a common consent form. So that is not allowed as per NMC. Okay, yes. So this is about the dichotomy we discussed, guys. So next, let's see what is the proceeding. What is the proceeding? Yes. Have you understood, guys? Can anyone reply me in the chat box? Any doubt you can ask me? Any doubt about this definition? Yes, about this. Come on, guys. Yes or no? Say yes or no. Any doubt? Am I very slow, very slow, very fast? Am I very boring, very boring? Hmm? So yes, give me suggestion at the YouTube chat box. Yes, come on, guys. Open pharmacy. Sir, open shop and open pharmacy. See, doctor can open his clinic in his name. Doctor cannot open a pharmacy shop in his name. So doctor cannot open, legally he cannot open any pharmacy in his name, especially in the surrounding of the clinic or nursing home. So you are a businessman, you can open clinic everywhere, but in the name of you can run that business. So okay, yes. Yes, Samadip Sarkar, sir, you are not at all boring. Yes, sir, making interesting. Okay, per patil fine. Chalo, ठीक है, ठीक है. So first few chapters in forensic medicine a bit difficult to understand. I'm trying my level best to teach you. Yes, okay, fine. Okay, understood now. 5 marks question, 6-8 disco. Fine. Chalo. Next, we are going to discuss about proceedings in professional misconduct. Proceedings in professional misconduct. So what happens when doctor is involved in professional misconduct? Okay, so that is what we are going to discuss about. So this can be a 3 marks question. Proceedings in professional misconduct. Anybody who is taking the action when doctor is involved in professional misconduct? So options are state government, central government, central government, state government, Indian Medical Association, State Medical Council, SMC. Anybody? Can you answer this? Say example, a doctor is involved in certain infamous conduct. Like example, Arjun Reddy, alcoholic surgeon. So who is going to take the proceedings against him? Anybody? Is it state government, government of Delhi, central government, or Indian Medical Association, Association of Doctors, or State Medical Council? State Medical Council. Okay. So it is basically State Medical Council. Good answer. So answer is State Medical Council. Correct answer. Good. SMC who answered by Sarkar again and Ananta Krishnan and Mirza. Yes. It is not IMA. It is basically State Medical Council. So how is the proceeding goes? Usually a complaint from aggrieved person. So aggrieved person can be a patient or any person. So he do complain to SMC. So either offline or online complaint. So now it's very easy to complain. So online also, online or offline complaint within 2 years. Within how many years? Within 2 years of occurrence of incident. Within 2 years. Okay. Yes. SMC. Then once a complaint is registered, the SMC go through the complaint. If complaints or the matter is very serious, if the matter is very genuine, they are going to issue the notice. Okay, they are going to issue the notice to the concerned doctor. So doctor has to reply. So they'll issue notice to the RMP, registered medical practitioner. Okay. So doctor has to reply within 15 days. Within 15 days. There are thousands of complaints every day from different person to the State Medical Council. State Medical Council, basically the staff, they go through the complaint and the substance of the complaint. If it is really genuine, then they'll issue a notice to the registered medical practitioner. RMP means registered medical practitioner. So doctor has to reply within 15 days. So once he gets the notice, doctor has to reply within 15 days along with his legal counsel. So he can appoint some lawyer, he can appoint some advocate to hear or to present his case in the State Medical Council. Okay. Yes. So the parties are allowed to bring any lawyer, advocate, a lawyer to represent them in SMC or EMRB or NMC. So you can go along with the lawyer. Then there will be a role of SMC. So after going through the substance of the matter, so they will hear the matter in front of the patient and the patient advocate, doctor and doctor's advocate. So SMC can take some actions. Anybody? What are the actions can be taken by SMC? Anybody? What are the actions can be taken by State Medical Council? Like example, Tamil Nadu Medical Council, Tamil Nadu, Karnataka Medical Council, Kolkata, so West Bengal Medical Council. What are the action can be taken? Anyone can guess? Can anyone guess? What are the actions? Come on, guys. Come on. Try. Let's make it interactive, guys. Let's make it interactive. Come on. Okay. The first thing, it can be uh, disposal of the complaint. Okay, disposal of the complaint. So there can be false allegation. So in that case, disposal of complaint can be taken. Then there can be suspension of the practice. Suspension of medical practice. They can tell the doctor, don't do any clinical practice for 1 month, 3 months, 3 months to 3 years, like that. Suspension of private medical practice, suspension. Or there can be monetary fine, or there can be permanent death sentence. So the permanent removal of the name of the doctor. So permanent removal of name, which is known as professional death sentence. So the question can be asked in your exam. Define professional death sentence. So your answer should be, sir, professional death sentence is removal of the name of the doctor from medical register in cases of professional misconduct. This is how you need to answer. So there are four possibilities. One is disposal, suspension, fine, and permanent removal. Yes, guys. Yes. Yes, jail. Jail, no, no. Jail not possible. Remember, try to understand, Partha Patil. So, jail is not the power of SMC. SMC don't have any legal power of jail. So, jail only by court, criminal court, not the civil court. Even not by consumer court. It is only by the criminal court. Try to understand, SMC is a state medical council. It is a legal body basically to look for the professional misconduct. The punishment can be only this four, not the jail. Okay? So jail is only by criminal court. Understood, Parth Patil? Yes. Then doctor can appeal. Okay. So all these condition, doctor can appeal. So appeal. So now I'll write here. So doctor can appeal to EMRB, appeal. So doctor can appeal to EMRB. What is EMRB? Ethics and Medical Registration Board. Medical Registration Board. So it's a board of NMC. It's a board of NMC. Okay, in any case, doctor can do appeal to higher authority. Higher authority is EMRB. EMRB means Ethics and Medical Registration Board. That is a board of NMC basically. Okay, so this is how the question can be asked in your exam. So this should be within 60 days. Okay, within 60 days. So within 60 days, so doctor has to appeal to the EMRB, which is the board of the NMC. So this is what should be the answer in your Viva. EMRB. Yes, he can appeal to the EMRB. So, okay. Now again, the question can be asked suspension. Suspension. Suspension is there. Suspension. Okay, yes. No, no, not in that. In any case, even suspension is there. Then also he can appeal. Not like that. Not only in professional permanent removal, even in suspension also he can appeal to the higher board, EMRB, higher board. Okay. Yes. Even in suspension also. Suspension again, level 1, level 2, level 3, level 4, and level 5. So basically, the punishment can be 5. So it is given in standard textbook. Level 1, what is that? Level 2, what is that? Level 3, level 4, and level 5. In level 1, it's only the warning. So in level 1 of the punishment, it's only the warning. Not the warning notice, guys. It is a warning. Warning given to the doctor. Warning given to Arjun Reddy. Don't do that in the future. Like that. So it is warning. So level 2 basically suspension for about 1 month. So don't do any clinical practice for about 1 month. That is about the level 2. Level 3 means that is up to 3 months. Up to 3 months. Level 4, 3 months to 3 months to 3 years. 3 months to 3 years. And level 5 basically PDS. That is professional death sentence. I'll repeat again. Level 1 is warning. Level 2 suspension for about 1 month. Level 3 up to 3 months. Don't do any clinical practice for about 3 months, guy. So that is what the 3. So 3 months to 3 years, that is basically a level 4. And level 5 is PDS, professional death sentence. Now look at this, everybody. Try to answer this. Look at this newspaper headline. So the doctor's medical license suspended for 6 months. So what is the level, guys? What is the level here? Can anyone answer? Anyone, can you answer this? 6 months it is. 6 months. 6 months. Level 4. Good answer. So this is basically a very good answer. Level 4 is the correct answer. Good. So I said level 4. So it is a 3 months to 3 years. So this is the level 4. Okay. I said warning is level 1. Up to 1 month is level 2. Up to 3 months is level 3. 3 months to 3 years. Then it is basically level 5. Okay. So you can remember level 3. You can remember level 3 is equal to 3 months. Level 3 is equal to 3 months. सबको लिखना होगा. Everybody keep writing this in the chat box. Level 3 is equal to 3 months. Write this in chat box. Write this in chat box, guys. Level 3 is equal to 3 months. 3 months. Okay, keep writing, everybody. Keep writing. Okay, Lion, beta, very good. Somajib Sarkar, Mirza, Wasama Sheikh, Manikarnika, Dr. Parth Patil, Sutapa Samant. Very good, very good. Others, keep writing, guys. Keep writing. Come on. So next is your MCQ test. So are you ready for the MCQ test, guys? So next we're talking about MCQ test. So this we'll discuss in next class. So next is your MCQ test, the final test. MCQ test. Ready, guys? How is the Josh, my dear students? So there are 10 MCQs. 10 MCQ. So let's see who is going to answer. Who is going to answer? And one who answer, I'm going to write his name over the slide. Okay. Yes. Come on, guys. Come on, guys. Disposal of complaint means beta complaint no action only. So doctor is innocent, no action. आप अपराधी नहीं है, so you are निरपराधी, निर्दोषी है आप. So doctor is निर्दोष. Okay, so that is what the yes. Good, energy is full. So how is your Josh, my dear students? Your answer should be very high. Say very high in the chat box. Very high. Come on, guys. Come on. ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ಹೃದಯ ರಾಗದಲ್ಲಿ ಕವಿತೆಯನ್ನು ಬರೆಯುವೆನು ಮನದ ಆಳದಲ್ಲಿ ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ವೆರಿ ಹೈ yes come on guys very high come on yes good yes very good next first question guys you need to write question number and answer A B C D like that. Don't do random thing. Okay. First MCQ. Following are professional misconduct all except. Okay बेटा ये except है. Except लिखना ठीक है. Except होना चाहिए. So गलती से आया होगा. Except है. Option A. Solicit patients through social media. So Instagram, Facebook. You are telling everyday message. Come to my clinic. I'll give you 100% offer. 10% offer, 5% offer. Using unusual law signboard with your photo there. Specialist. Non-association with manufacturing firm. Print self photograph in the letterhead a signboard. So what is this, guys? Yes, very good. 1C, who is first to answer? 1 Su by Manikarnika. Very good, Manikarnika. Excellent answer. C is the answer, guys. C. So C is the answer. So the first answer is given by Manikarnika. Manikarnika, you are very attentive in all the classes of SUSHRUTA batch. You will definitely get distinction in forensic medicine. Take my word. Take my word. You will get distinction. Pakka. ठीक है? Yes, good. Others also answered. Okay, next. Doctor can make formal announcement in press regarding all the following except option A, starting the practice. I am opening a new hospital today. So I am opening, I am giving one formal announcement in newspaper. My Dr. Manjunath opening a new nursing home in Bangalore. ठीक है, so सही है. Change of address, temporary absence of the duty. No, I am busy. I'll not be there for some time. I'm going to US for some time. So yes. Acquiring new equipment. Okay, new MRI lab is there in my nursing home today. Advertising himself. What is that? What is that, beta? So very good. The first answer is given by Lion. So Lion, beta, he said 2D. Beta, what is your real name? Your name is Lion? Is it Lion only? So it is basically advertising himself. Advertising himself. So rest all are correct. So this is correct, and this is also correct. Okay? So this can be a Viva question. So can we do formal assessment in press? Yes, you can do. We have that rights. Okay, we have that rights. I am Jaiswal. Okay, Jaiswal, beta, your name is Jaiswal. Fine, okay. Next question. Following are professional misconduct except. Again, except is there. Some student know they add except and answer. Don't do that. Don't do that. So the first option, running open shop. So for dispensing drugs prescribed by other physician. So me, a doctor, opening a separate shop for the patient. So I am selling all the drugs, all the paracetamol, other drugs. So even my patients also, other patients also, some open random person can buy from me. So what is that? Sell medication to his own patients. So yes, I can sell medications legally. Giving commission, taking commission. So for lab investigation, for referring, for recommendation. So you send a patient, I'll give you some amount for you. Prescribing secret remedies, so which he does not know the composition. So me, allopathic doctor, giving some Ayurvedic medicine. Ayurvedic medicine. So even I don't know the composition, then what it would be? It would be definitely professional misconduct. Hana. So what is the best answer, guys? So best answer is 3B. 3B, Hana, 3B, very good. It is a true statement. True statement. So B is the answer. So answer is B. Answer is given by Manikarnika and Somadev Sarkar. Sarkar. Good, Sarkar. Good, very good. Next, following a professional misconduct except prescribing drugs in brand name, brand name only. Writing some drugs in brand name. So instead of writing paracetamol, so paracetamol, I am writing some brand name. Brand name I'm dying. Okay, brand name I'm writing. So is it definitely professional misconduct? Don't do that. You can write paracetamol, generic name. Does not maintain medical records. You need to maintain medical records for 3 years. 3 years, beta. No, you are not maintaining. Does not display unique registration number. So as a doctor, I need to mention my registration number in my clinic, in my prescription. So maintaining professional secrecy. You need to maintain professional secrecy. So that is a true statement. Hai. So 4D. 4D who answered? The first answer by Ananta Krishnan. Beta Ananta Krishnan. Anant. Anant is also a very regular student in all the classes. Great. Next question. All are pillars of medical ethics except autonomy, that is the patient right. Beneficials, doing upakara, not doing any ahitakara, that is known as non-maleficence. Non-maleficence, do not harm patient. Paternalism, best interest of doctor. So I am doctor, I am like a father, I am like a god. I can do whatever I want. So that is what the paternalism, like a boss. So never act as a boss. So anybody, what is the best answer, guys? So it is your paternalism. C is the answer. I think who answered? Somirip Sharkar. Ananta Krishnan again. Lion is again okay. Sutapa. Okay. Sutapa, what is your final name? What is your name? Sutapa. Sutapa Samantha. Samantha, no? Yes, Samantha. Good. Paternalism means what? It is the basically you are taking your decision. Basically, doctor is taking decision. Paternalism, like a father, like a father is taking decision of entire family without the consent of the other, members. So it is paternalism. Head. So don't do like that. So you need to take the consent of the patient. Paternalism. Okay. C. So Smaranya. Okay. Smaranya. Fine. Okay. Okay, good, Smaranya. Doctor decides best treatment for patient without consulting patient. Without his consent is known as doctor decides best treatment. So doctor decide best treatment. I am going to decide your best treatment. You don't worry. So leave it on me. So when patient is asking, sir, I have some priorities. So you are telling, no, I am the boss. I am going to take the final decision. So what should be your answer, guys? Is it autonomy? Definitely it is not autonomy. Yes, autonomy also a correct answer here. Non-maleficence वो भी नहीं है. Beneficence no. So it is basically C better than E. C better than E. If C is not there, then the answer is autonomy. Okay, autonomy. 6C. Good answer. Who answered 6C? 6C. 6C again by Manikarnika. So Manikarnika, good answer. Good, good. Manikarnika, good. Okay. Fair distribution of health services. Health services. Regardless of gender, male, female, third gender, race, Indian, European, American, religion, so whatever religion, caste, so it is related to which principle of medical ethics? Autonomy, beneficence, maleficence, justice. Come on, guys. So this is your justice. C. C. So this is basically given by Mirza. Mirza beta, very good. Mirza. Patient died due to improper counseling by a medical professional. Medical professional. So it is against improper counseling. Patient came with a history of non-venomous snake bite. Non-venomous, most of the snake bites are non-venomous. Then some medical professional, he said, you are going to die in half an hour. You are going to die in 2 hours. It is a venomous snake, something like that. So improper counseling. Improper counseling and leading to death of the patient. Who knows? Patient will die not because of the snake venom. He died due to fear induced by you. He died. So it must be what is that, guys? This is basically non-maleficence. So you are doing harm instead of help. Okay, you are harming the patient. So that is what the non-maleficence. Okay, good. Next, identify the symbol of a winged stuff. A winged stuff is there, rod is there, with the wings are there, and two snakes are there. Snakes like this snakes, snakes. What is this? It is a symbol of caduceus, symbol of rod of Asclepius, Red Cross emblem. I am a painted logo for allopathic doctors. So anybody Red Cross emblem? Definitely no, 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 no. Okay na? Indirect method. It is not a logo for doctors, guys. Chalo, theek hai. This is one of the common symbol used by the medical professional. Winged stuff. You can see here like this. A rod is there, and a snake like this. Okay, snake like this on both the side, and a wing is there like this. Wing is there. So what is this, guys? So this is not the IMA logo. It is not Red Cross emblem. So answer between caduceus and rod of Asclepius. So the best answer, guys, when you see two snakes, it is the logo of caduceus. It is the logo commonly used by the doctors. So it is not the true symbol actually. It is the symbol of travel, symbol of peace, symbol of business. So it is used by the doctors worldwide. It is not a true symbol. So two snakes are there and a stuff there in between and wings is there. It is a caduceus, a symbol of business. So Rod of Asclepius, let me see this. Okay, this is what the rod of Asclepius. You can see here. Okay, so this is caduceus and Asclepius. So in Asclepius, it is a true symbol, guys. It is a true accurate symbol, accurate symbol of medicine. Okay, because Asclepius is the god of healing. So god of healing with a snake around it. So this can be asked in your viva. It can be asked in your forensic examinations. Okay, so try to understand this. So what would be the correct answer, guys, for this question number 9? What is the best answer? 9. Answer is A. Good answer. Good. Identify the symbol. A single serpent entwining a rod. Caduceus, rod of Asclepius, Red Cross emblem, IMA painted logo for allopathic doctors. Come on, guys. Come on, come on. Yes, can we try this? This is your rod of Asclepius. So, god of healing. So, god of healing. All of you guys, why snakes everywhere? Why snakes everywhere? You see any symbol, there's a snake is there. Why snake, guys? Anybody can answer? Why snake? Snake. Anybody? See, this is true symbol because it is the symbol of Asclepius, god of healing. That caduceus is the symbol of travel, symbol of business basically. So it is not the symbol of healing. Caduceus in Greek mythology, it is the god of travel. So we do doctor travel, we do business, everything that is fine. But accurate is the this symbol. There are different opinions from different doctor. They say caduceus is better than the Asclepius. So it's a left to you. So in a standard textbook, it is given. True symbol is this. Okay. Poison. Anybody snake? Why? Why snake? Why snake everywhere? Yes, come on, guys. Why snake? Why snake? Anybody? Why snake? In previous snake bite was very, very, very fear. No, 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 no. ऐसा नहीं है. Sudam, no, 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 not like that. Snake. See, in Greek mythology and in some books it is given. Snakes, you know, it is nothing but purity, purity and rejuvenance. Okay, so that's why rejuvenation. So look at this. I know. Look at the snake. Can you see the outer layer of the snake? I know. So this is something related to this picture. Okay. So purity, pure sense. So that is the reason. That's fine. Okay. Next. So this is the logo of I. This is the logo of Red Cross emblem. Red Cross emblem. Red Cross emblem. Okay, it is punishable. I said 500 rupees fine. So according to section 12 of Geneva Convention Act 1960. And this is the IMA painted logo. So this is the IMA painted logo for allopathic doctors. So using this is a legal one. So it's a legal symbol. So you can use this symbol. So once you become doctor, you can use this symbol everywhere. So that is over your vehicle. So whatever it is. So this is the symbol painted by Indian Medical Association, same like a Red Cross emblem only, but at the center, if you see, there is a name doctor, DR is there. So this is what this is Red Cross emblem, and this is the symbol of caduceus, and this is the symbol of red of Asclepius. So this is what the question number 10. So god of Asclepius. Chalo, theek hai. Next is your score. What is your score, guys? Come on. Out of 10. Out of 10, you must get 5 just to qualify. I'm not worried about your score. I'm worried about your more than 5, less than 5. So at the end of the class, if you are getting more than 5, I'm very happy. Very, very happy. Very happy. Okay. Okay. So good. All of you, what is your score? Mani Karnika got 9. Okay. Osama, very good. Sir, what is paternalism? Paternalism means like a father. Doctor is taking decision irrespective of patient's opinion and patient consent. So doctor is taking his decision. So in treating the patient, his own decision. So not in the favor of the best interest of the patient. He is for the best interest of himself. So that is what known as paternalism. Paternalism like father, father. Okay. Yes. 8. Good, all clear, excellent, all cleared, excellent, all they cleared our examination out of 10 question. I'll repeat all the 10 question. First question number 10, 1, 2, 3, 4. I know there are 10 good questions from the previous year examinations. So all answered. So many of them got 8, 7 like that, more than 5. I'm very happy guys. Thank you so much. If you have any doubt, you can ask me now for next 5 minutes. Next 5 minutes. Dr. Parth Patil, thanks for amazing session. Yes, Parth Patil, you are very attentive and very interactive. That's really nice. Okay, good. So, okay. Jaiswal, okay, thank you. Bye. Any other doubt? Is it under professional misconduct? Yes, can be professional misconduct, but it is against the rule, pillar of medical ethics. That's why. Somadev Sarkar, Somadev, Somadev. Yes, come on, guys. Mirja, okay, fine. Okay, Ananta Krishnan, fine. Okay, what is the full form of EMRB? EMRB. See, E is ethics, beta ethics. M for medical registration, medical registration board. So it's a board of the NMC. It's a part of NMC, National Medical Commission. Okay, Devang is asking, can a doctor have a relationship with the patient with his or agreement? Okay, so yes, so but remember, it's basically while treating. I'm telling you, while treating, while you are in the service. So it should not be with the anything related to a profession. So it is basically, if it is really personal, that is fine. So, but in treating patient, in relation with your medical practice, if it is coming in between, then it is infamous conduct. Okay, understood, Devangan? Devangan. Okay, that's it about today's class.